Yay.
That's awesome.
And welcome to the Pandora podcast. Host again, this is Dr. Kevin Gutaro, my co-host, Dr. Melissa Cady.
Hello.
I ghosted in like a virus, didn't I?
You did.
You didn't even see me coming.
Well, we thought we'd start off not necessarily talking about what I talk about all the time, which is the pandemic, but the pandemic. And there's just so many things that are evolving. Do you want to, I guess for me, this last week, it's been taking it seriously. I think we're the first ones to try to not necessarily minimize what viruses or infections can do, but we also appreciate the importance of not overreacting and being mindful and keeping your wits about you so that you make good choices. And I know you've had some changes too on how you're really seeing things evolve now. You want to talk about that?
Yeah, so it's been really interesting because my wife's actually a physician, and she, when we were in residency, she was actually doing a research project on SARS. It just kind of coincided because she was on home leave because of one of her kids was born, blah, blah, blah. So she's had this interest in sort of viral pandemic since then. She ended up actually contracting H1N1 when it came out. And so this started surfacing, and she has been following it pretty aggressively. And me being me, I was like, okay, whatever, don't worry about it. Then we also have family in China, and they ended up getting trapped. They were actually on holiday. So they left China, they were on holiday in India. And then the airline just canceled their tickets, didn't even tell them. So they were in the middle of India, and they're like, oh, what are we going to do now? They have a house in Portland. So they flew to Portland, and then they were stuck and they couldn't get back to Shanghai, which is where they were. And, so we were sort of living the China experience through them because they're business owners, and they're trying to do all the video teleconferencing, everything that we're trying to do now, they were already doing. And we were talking about the lockdown because we had all this stuff happen at the same time. There was some personal tragedies and things, and trying to figure out how you do all this stuff. And then to watch the China experience and hear it, because they're directly involved in healthcare in China. And what was occurring is like, holy crap, this is unprecedented. And for whatever reason, I knew I'm like, it's going to get here. It's going to get here. But I have this kind of weird thing until it actually gets proximal to me. Like it doesn't fully hit. I'm just like, I know it's going to come, I think we're ready for it or whatever. But last week, at the beginning of the week, I saw that graph on the social distancing aspect. And it was the N+1, the difference between one day. And the importance of that graph is because this is an exponential growth curve. Mm-hmm. You can't comprehend that. Like the brain just can't. You can think about it, and you can say, oh yeah, that means this, and it doubles, and if it doubles, it means this. But for me at least, I had to see that visual. And once I saw that, I was, holy crap, this is a big deal.
Right.
And in our particular household, that's when we fully aligned together. I would say as husband and wife, and we're like both in agreement. Like, all right, this is what we're doing. We don't care what the school's going to do. We'll probably keep the kids out. Luckily, a day later, the schools here got canceled for 2 weeks, and now until April 28th. And then we really instituted social distancing. Our friends, my kids are like, oh, my friends are meeting up, but we're like, well, you can FaceTime them, but we don't want you out.
Right.
You just really shouldn't be doing that. And I think that, and then since that time is just kind of following it. And I think at this point in time, I'm hoping everybody sees how serious this threat is. Although I know people don't.
Right.
And this is, I think for healthcare, people involved in healthcare and really physicians specifically, this is where that knowledge comes in, where I don't think people realize and I'm not trying to panic anybody, but this is serious. And if you're not actually honest about the seriousness, it means we can't respond appropriately. And we need to recognize that this is a serious situation. Is the world going to end? No, but the world's going to change. Right. And it's going to change quite a bit. And the effects of this are going to last not for weeks, but months and months and months, if not years. So I don't know. What your experience has been?
Well, it's been interesting because I had been working in a hospital outside of Austin, And so about 4 weeks worth in a hospital setting, dealing with a lot of ICU patients, not necessarily anyone that specifically was known to be infected with the coronavirus. But when I finished that commitment, which was a couple weeks back, and things were evolving with this, I felt in some ways very fortunate that there's a mixed bag, because part of me felt a little guilty because I'm getting called to go work in that hospital. I'm not going to specifically say where, but here in Texas and fairly big cities. And there's a part of me that feels grateful that I'm no longer an employed person that feels compelled to have to fulfill my duties as an employee. And being that I'm independent, I can pick and choose the work I want to do based on whatever reasons I feel fit. So I've had this huge moral dilemma within me to, part of me, I think it's this, I don't know what it is about this, the helper in you when you're in the medical profession. And I don't mean just physicians, I mean nurses, anyone that's been used to helping, stepping up. There's a guilt you feel for not being part of that role to help people. But part of the reason that I don't want to put myself in that situation is not because I don't want to be there and help and use my skills to do, for the greater good, but there's these issues, these moral dilemmas that we're facing. And I know because of people that are on the front line right now that would rather be home and are doing cases that have already been suggested by guidelines and the American Society of Anesthesiology, based on CDC guidelines, all the other things put together. And they're saying not necessarily elective. That was the big wording last night. I listened to the webinar, the town hall meeting from the American Society of Anesthesiologists. And they were saying it's more about non-essential, because there's a gray area there when it comes to elective cases. I mean, there could be someone with cancer could have impending doom, that it technically is elective, but it's a little bit more essential because of, if they don't get it done within the next 30 days, there could be some major catastrophic issues for certain organs or whatnot. So there's a real big gray area, and I already know that the work that's being probably asked of me is going to be involving outpatient surgery centers that are still, despite the recommendations, strong recommendations to cancel all elective surgeries, they're still being done. And the worst thing about this is that some of these, well invested by even medical professionals, these high-end surgery centers, and I'm not calling out all of them, there's a select few, but there's stuff definitely out there for right now, is that there is a lack of understanding of the filters that are required to keep themselves from contaminating the machines internally that would basically be delivering potential virus to future patients. And these are things that, not to freak everyone out, but there are some places that are not fully aware of those types of filters that can be put in place to minimize. Doesn't always mean 100%. Most of those HEPA filters are like 99.9% eliminate, viruses, bacteria, and whatnot. But anyway, that's my biggest concern, is that I'd be putting myself in a predicament. It doesn't solve the problem. But for me to sit there and think, I feel compelled to do the case because everyone's expecting it, but yet I don't have the proper gear, especially if I don't have an N95 mask, that this person who's 70 years old but still getting a procedure that really shouldn't be getting this elective or non-essential surgery done. I feel for my colleagues that feel pressured in those situations. It's
ridiculous. It's absolutely ridiculous. And these institutions and facilities should be called out. And for a number of different reasons, because I do like the word non-essential. I think that's better, because if you have someone has a crushed hip, right, and you're going to do a fixation or something, that is technically elective. But in the same token, if you can get them up, moving again and out of the hospital that becomes a semi-urgent procedure versus some, some ridiculous now, a knee arthroscopy for somebody with knee pain, or even a spine fusion for somebody with back pain. Those are elective procedures that don't need to be done.
Mm-hmm.
And your words of lack of awareness of the filters, I think they're fully aware of not of the filters, but they're fully aware that what they're doing is they should not be doing is, but all they can see is the dollar signs. And this really brought me to home the other day, because I started calling around in my regional area because I was looking for, I wanted to know what they're doing, because there's this talk and from multiple different things, and people may get pissed off at me, but personally, from an outside of observer, and I've had multiple experience with multiple different healthcare systems, the lack of fully invested, engaged leadership on healthcare systems on a good day is shocking. And when you have a crisis situation, this is what you see. There's nobody driving the ship anywhere. And so I was curious, is like, well, are people canceling elective cases? Because we shouldn't be doing these things. Every ASC, so ambulatory surgery center for people who don't know, which are standard, supposed to be day of surgeries, you go in and you go out that day. That could basically become an ICU facility, or at least a ventilated vent facility, if we get things, if things go the way they're projected to be.
Right.
Where we're going to need a lot of vents, and we're going to need, and that's important because there are certain people that if you get them on these vents and support their respiration for a given amount of time, they can recover. And if you don't have it, they're going to die. That's criminal to me. And the other part that just kills me, so I don't know. So I know Texas, I think Texas is a little behind the curve on calling out like statewide levels. But here in Oregon, if I learn of a facility is still doing elective procedure, I will call them out, because we've told the restaurants to close. So what we've done now is we're saying, hey, you restaurant owners and you service providers who are many times, are trying to do the best they can, but they're living at a much more distressed level. Like their income is a lot different than a healthcare provider, and certainly a healthcare CEO. And we're asking them to sacrifice for the greater public good. And these facilities aren't doing that.
Right.
That makes it is absolute flat out greed. It is a violation of the Hippocratic Oath. And it just is just absolutely disgusting to see that type of behavior.
Yeah. Yeah. And if anyone should really appreciate and understand this nuanced, invisible virus, the potential for exponential growth, not only within minutes, hours, and days in one individual, but the way it can rapidly, exponentially spread throughout the world. I mean, the medical profession should be the first ones to be the one to implement that type of leadership. And, you're right. I mean, there is I guess my passive approach to it right now is not willing to accept the work to put myself in that predicament. But a more active, perhaps more brave approach would be to literally confront them and demand closure until we get some sense that this peak is, we've gotten over the hump and in a declining numbers at least before we even consider. But, there's horrible things, if we can't get the morals and ethics of this situation accomplished on the front end as medical professionals, then what we're going to end up being like is in Italy, where the moral dilemmas will be of a totally different nature and will be of who's going to die versus who gets the respirator or a ventilator.
No, absolutely. The other thing that I was hearing from a major metropolitan area, who again, high volume, these institutions, these business factories, driving people through with basically procedural based whatever, seeing people as widgets to profit from. There again, from a federal standpoint, we've had some dramatically weak leadership, and again, nobody's giving guidance. And so when the CDC is kind of waffling around on their guidelines and changing the guidelines, not because the virus has changed, but because they realize that we don't have the protective equipment. And so they're saying, well, we don't have N95 gas, so you can use it. And they're not saying that because it's a better choice. It's because there isn't anything else.
Right.
And to have healthcare CEOs and administrators saying, well, the CDC guideline says you don't need that. So why are you complaining that you need an N95? And to that, I'm like, okay, well, here what I want to see. I want an administrator on every single working floor. I want an administrator who is in those ICUs for every intubation. I want them to be exposed using the exact same equipment or less than anybody else on those front lines. And let's see you have that same conversation of what's appropriate and safe, and whether or not we should be screaming for more PPE. It's just yeah, I don't want to get too mad about it, but
well, I think, I mean, you're looking at someone right now, myself personally, who's been just recently doing anesthesia, feeling disinclined to be part of helping people in need because of the lack of preparation and lack of equipment and supplies to protect myself, who could be wiped out of this equation. I mean, I'm fairly young and healthy, but there's no guarantee. And or the fact I'd be put under quarantine for 14 days if I did get some type, of exposure to the coronavirus. This is something this is a real issue. And unfortunately, we have to learn the hard way that you have to be prepared for these things and do the right thing and be prepared for these things, and not, after the fact realize, oh, well, we should have done this differently. So.
And there's definitely the fixing the blame thing that can happen later when we can point out the multitude of favors. But right this time, what we need to be doing is fixing the problem, and that requires everybody to make sacrifices. And it certainly doesn't mean that for healthcare workers out there to be exposing them using inadequate protection for somebody else's, for something that doesn't need to be done. Right. No, you would go off, and if there was someone who was crashing, and you needed to intubate them, and you knew they were going to die, and it was a life or death scenario, you would do it. Like I would do it. You would probably do it. You wrap a bandana around your head or a sock or something, and like, well, it does not work, but you would do it. But someone telling you to do it so that you can go do, again, a knee arthroscopy or some ridiculous thing that is completely non-essential.
Right.
That's criminal behavior in my book.
Right. And I'm not just speaking of myself, it's that other part. If you keep putting people, whether you have a regular breathing tube or a little airway device called a laryngeal mask airway, which they're highly suggesting not using if you're going to have to manipulate the airway for several reasons, but that can be another discussion. But you are hooked up to the machine. And so if we're allowing all these different people, regardless if they show symptoms or not, but they're basically providing virus to the machine and they're not using those filters, then I feel like I'm doing something to harm the next patient. And it's not just about that patient, it's everyone after. And so that's why the whole supply chain issue with having these filters and having, just the ethical approach to this is that if you are going to continue to do some cases, you've got to have the filters in place, because these machines are being exposing to everybody else.
Well, and on a broader scale outside of anesthesia, I've seen people being said that hospitals are telling them not to wear a face mask when because unless you know that the patient's infected, then don't use a face mask because you're going to cause panic. Well, it's not.
Nothing wrong with wearing it. There's
nothing wrong with wearing a face mask, and the way to think about this epidemic is not I'm wearing a face mask to protect myself, but particularly from a healthcare worker standpoint, is I'm wearing a mask to protect my patients, and be able to have that discussion and say, well, why are you wearing masks? Do you think I'm infected? No, I don't think you're infected, but I'm seeing everybody every day, and I'm wearing this mask to protect me, help protect you from me. Simply because we know there's asymptomatic carriers, and this is a mask which, other than N95 masks, they're really designed to protect others from the individual wearing them. So it just drives me crazy is that we're not doing well. I shouldn't say there's some heroic examples that you're seeing, but you also see the downsides too, where people are doing less than heroic actions for the completely wrong reasons, and that's really frustrating.
The things that when I was watching that webinar yesterday, I mean, I know I'm focusing a little bit on anesthesia, but that's where a lot of the activity is still going. Um, there's there were a lot of people concerned about just the environments that they're working in, and being prepared for those things, and we're only at the beginning of that, this curve. At least we don't know for sure. I mean, none of us can predict the future, but there was a really interesting video, not related to this webinar, but earlier that day, that I saw from a PhD that was trying to really drive home the point that this started with one virus, like possibly one virus organism that has projected itself around the globe because of our many ways that we can circulate things a lot quicker and within a short period of time. So I think it behooves all of us to really let that sink in, that this is serious. If he can do that to this point now, just imagine what's going to happen down the road. So yeah, we all need to stay home, and I'm staying home. I'm quarantining myself. I know you are.
Oh yeah. I mean, yeah, we're isolating, or not
Isolating, yeah.
under formal
Distancing, isolating.
Yeah, physically distancing ourselves.
Yeah.
But,
I've seen way more neighbors than I usually have, just because everyone's getting outside to walk.
Well, that's the fastest way you get people out of their houses. You tell them you shouldn't leave your house, right? Yes.
Right.
The first day we told our kids that they couldn't leave the house, they're like, well, we want to go for a walk. And I'm like, well, you guys can go to a walk together. And they did. I'm like, I don't know the last time they went for a walk together.
Yeah. The moment you tell a human they can't do something, they want to
psychologically
fight against it.
Goes right away. But yeah, it's been interesting, and we're definitely we haven't seen anything yet. I think that's the other thing. I've been using an analogy of like a tidal wave, and you don't see a tidal wave coming. What you see is the tide go out, and you say something looks different here. And once you see that tide go out, you could, if you're sitting around waiting, well, maybe or maybe not, there's going to be a tidal wave. By the time you see it, it's too late.
Yes.
And in this situation, in this particular situation, we have actual data because we have China and we have Italy and we have those other countries that we can sort of model and extrapolate from. And yeah, it's going to be, again, I'm not trying to panic anybody, but you got to take this seriously. This is not something to goof around with.
Well, the thing is that everyone can implement the basic precautions, and washing your hands thoroughly, being aware of what you're touching. I mean, I think people don't realize all the various surfaces that they touch, and keeping a distance. And I know they've been giving the 6 feet as the guidance, but I did want to mention to you, Kevin, that my husband gave, because my example of one virus spreading across the world wasn't really good for non-medical. That was his suggestion, to not try to explain it the way I just did, but that it's more like a brush fire, and that it starts super small, but it can become a mammoth fire later on, and that it can exponentially grow from something super small, and to respect it in that way. But I figured the fire
we all
you might like.
Fire is awesome. We love fire. Fire is a wonderful thing, the science of fire. But yeah, and that's true. And it's even worse when you're unprepared, right? When you have a lot of dead wood and brush and stuff that hasn't been cleared away, and you're lacking effective equipment, and you haven't really paid attention to it for a long period of time. Yeah, it's going to be interesting.
And you keep fueling it with a whole bunch of young kids that don't know that they're carrying it at like the beach, and they just
just keep going. And and that's and the long and short of it is if you're healthy, you are at significantly less risk than if you are unhealthy. But the problem is we don't know, even if it's one person out of 100, even 500, you want to take that risk. And then here's the other thing. So then you particularly have a bad case, and then you need a ventilator. And if you had that ventilator, you would actually be able to survive. We'd vent you for it's a long time on the vents, like a week or longer on a vent. But if you do and your body can recover, we can get you off, unless there's no vents available.
Mm-hmm.
And that's that's the part about flattening the curve that I'm wondering if non-medical people don't quite get. The fact is we're going to get infections. We know we're going to get infected. We know the vast majority of infections are mild, but when you have, you know, 1 million people infected, 1% of 1 million people is a lot, and we don't have enough ICU beds for that. I mean, we're not even close to that number of
Mm-mm.
ICU beds that we really need. So
Right. And I think that's part of what the government, and this is just through hearsay through the town hall webinar last night, was just once they realize the total number of beds and where these numbers are going, it really struck home that we're not prepared to handle this kind of catastrophe. So we have to minimize that load. You know, unless, you know, for some reason someone can come up with a disposable, you know, personalized, inexpensive ventilator that you can just turn on and give just basic breaths so that you don't have to have someone manually ventilating them for a week because you don't have a ventilator. I mean, that's the only other option. But you probably need a little bit more sophisticated ventilator settings for some of these patients. But yeah, it's one of those things that we're all starting to realize how dire this could look if we don't stay home.
yeah, and that's just on the health end. We haven't talked about everything else that's involved.
Yeah. Yeah.
Yeah, crazy.
Yeah. Well, you know, we somehow talked about the pandemic for about 35 minutes.
Hopefully we didn't. I don't. Again, don't want to scare anybody, but you want to be seriously cautious about what's happening right now. You know, when people are shutting things down or saying things we're going to shut down, it's not that people don't understand the economic consequences. People understand the economic consequences, but if you want to have, you know, seeing death rates of thousands of people in a day, do nothing, and we'll have it. And again, the vast majority of the country probably won't die, but you're gonna probably know someone who does.
Right.
This is serious stuff.
Right. And it may be some of the healthcare workers that will no longer be able to help out for the future, which will change. We already have, you know, not enough people to do a lot of the work out there that needs to be done. So,
Yeah.
And I just found out an eye doctor friend of mine had to close her practice because she can't sustain the practice. So it's shut down indefinite for right now. We're not sure.
Yeah.
But yeah, there's some people know the consequences financially, but sometimes doing the right thing is making those hard decisions.
Absolutely. And then they're hard decisions. Definitely.
Yeah. All right. Well, I'm sure we'll talk about the pandemic again on an upcoming episode. But for now, I think it's no better time than to say what Kevin always says: be well.
I've changed that though.
Oh no, stay well.
No, now it's stay well and socially distant.
Oh, that one's good. I like that.
Yeah.
I second that. See you next time.